Welcome back to Visions for Health. I'm Wendie Trubow, and my guest today is Noelle Lee, Doctor of Osteopathy, board-certified family physician. Welcome.
Thank you, Wendie. Thanks for having me.
Thanks for being here. So today we're going to talk about osteopathy. When you were a child, did you know you were headed for osteopathy school? How'd you get there?
No, I had never heard of a DO until actually I was in massage school. And as we learned different massage techniques, realized that many of them had come out of osteopathic training and osteopathic tradition, including things like some forms of myofascial release, strain counter-strain, something we called orthobionomy, but was actually from an osteopath, and craniosacral therapy.
So you went to massage school.
Yep.
You were a massage therapist.
Yes.
Then what happened?
So I came out of my bachelor's degree with many people telling me I should do medicine, but had no exposure, no family background, and just wanted to have babies and just thought this is incompatible, and wanted to be a midwife. And so for those first 10 years after my bachelor's degree, I became a midwife, I became a massage therapist, I had my own babies, I had lots of fun delivering babies, and then came to a place where it wasn't enough anymore. I wasn't satisfied. I wanted to take care of the whole family after the baby was born and do well woman care and do pediatric care. Mm-hmm. So went back to do my pre-med coursework. And even though I knew about osteopaths, even then didn't realize that a DO degree was really equivalent to an MD. So I went to my pre-med advisor and said, which of these 8 medical schools in Texas, which is where I was, should I go to if I want to do holistic medicine? And he said, you should go to the osteopathic school. And I said, but I want to make sure that I can be credentialed in all the states and get the same training. Mm-hmm. And he was an Army doc who'd worked with lots of DOs and said, no, it's exactly the same. And I applied early decision to Texas College of Osteopathic Medicine and
here
never looked back. And was thrilled that I did have the opportunity to continue doing hands-on healing because it's a piece that I love.
So how do you describe osteopathy to someone like me who can't describe it?
Well, you know, there are different aspects of osteopathic medicine, and about 5% of the doctors in the country are osteopaths, but only 10% of them practice osteopathic manipulation.
So 5% of docs are osteopaths, but 10% of those 5%.
Yep.
So a really small percent.
Yeah. Okay. Yeah, so we all get that in our training, but not everyone is drawn to it in the same way and pursues further education and really makes that their path. So you see lots of DOs and hospital staff in there. You can do any kind of specialty as a DO, but then there are those of us who really love the hands-on, what we call, you know, the osteopathic piece of it, which is the piece that does make us different from MDs. And so the osteopathic manipulation is it's grounded in anatomy. Us DOs, we get together and we talk about, you know, embryologic development and which nerve came first and went where, and development of different organ systems. We're total anatomy geeks. And then based on anatomy, many different techniques have been developed that are part of osteopathic medicine. And so there are lots of more vigorous techniques that are like popping and cracking like chiropractic or deep tissue kind of techniques. And there are lots of very gentle techniques like cranial osteopathy and myofascial release and just kind of indirect release techniques. So any DO who practices osteopathic manipulation will do any range of those techniques. I kind of go towards the more gentle side myself just because that's what I like to do.
I have a million follow-up questions
Okay.
from what you just said. So the first thing you said is you start with the anatomy and how things developed. Why does that matter?
Well, as we put our hands on people, we find interesting relationships between different muscles and organ systems that you wouldn't think would be related. And it doesn't make sense until you go back to embryology and look at how those different systems developed next to each other, and then as we grew began to separate but still have this neurologic relationship.
Is there some basic premise that holds osteopathy or that osteopathy rests upon in terms of its approach?
Well, one of our core tenets is that structure influences function. So in traditional allopathic medicine, it's really biochemistry, and it's really about the function of the organ systems. And we also practice that kind of medicine. But we look at structure. So if something is out of place in your body, or you're holding your posture funny, or your muscles are tight, they compress on nerves and arteries and lymphatic flow, and then it impacts the function of those organs. So when we treat people, we're trying to normalize structure in order to normalize function.
I can feel myself sort of trying to sit straighter as you're talking about this. So you're saying that someone's gut function, adrenal function, the internal organs, the stomach, the liver, those can be influenced by how one holds oneself, or the nerve impingements, or the structural abnormalities or imbalances.
Yeah, and we usually take a very detailed history about trauma, often about birth history, if birth was particularly traumatic, any car accidents, falls as a kid, because all of that impacts you as you grow and then will impact function. And also things like just being anxious and holding yourself tight all the time. And we come back a lot to the autonomic nervous system, to the fight or flight response versus the rest relaxation response. And we work on those nerve pathways. So
you mentioned that there's osteopaths who range from more pop and crack to slightly gentler or craniosacral. Can you explain the difference and how each works?
I like to describe it as different doorways into the same room. Our goal is all the same. We all want to remove barriers to optimal function of the health of your system, because your body is always striving to be healthy. And so we just want to get the other junk out of the way so that it can do what it's trying to do. And so when you're popping and cracking, you're taking a bone that's out of place and putting it back into place, and then your body reorients around that shift. When you do a more gentle technique, you're working a little bit more from the inside out. I'm trying to contact your nervous system and say, wouldn't it feel better if you were like this? And then give it a chance to reorient around that and say, oh yeah, actually, yeah, that's better. And then your body makes the shift. So they're just different ways to the same goal.
So when you're doing your treatments, people are dressed, they're not dressed, how does it work?
People stay dressed for my treatments. My treatments tend to be very relaxing. I think the biggest comment I get is, wow, it really felt like you hardly did anything. And then I was really sore the next day. And then the next day I felt great. Do that again. Like, I don't know what you did, but do it again. So it's a very relaxing experience for the most part. I do like move stuff around here and there and stretch you a little bit, but some people can kind of take a nap by the end.
And so you're saying that when someone just lies on the table, I'm not really skeptical because I've experienced this, but yeah, no, I can imagine if you've never heard of it, you'd be like, what? So you lie on the table, and you're saying you're not typically popping or cracking. You're more looking at the autonomic nervous system and whether they're riled up or able to calm. And you assist, how do you assist the system, essentially? How does that occur? And how do you get training in that?
So it's very subtle motion. It's, and you know, I feel like osteopathy is a little bit like quantum physics. Like, we're really well grounded in science. We study our anatomy like nobody you've ever seen. And then when we put our hands on, something happens that I can't necessarily explain from a scientific perspective. Although I've had thousands of hours of training in it, it's not like it's something magical. It's a real learned skill. But there are ways to contact the body to get the nervous system to settle, to reorient with that health of the system, which for us, we talk a lot about resonating with nature. Nature is perfect and healthy. How can our bodies get back into that space where we are in resonance with that health of the world? What else?
Does this work on everybody?
Oh, I know, I'm sorry. The one other thing I wanted to say was for cranial osteopathy, We're feeling fluid fluctuations, and they're very subtle. And so when I have my hands on you, I'm feeling, but I'm not necessarily doing a lot of moving. And then it's very subtle movements to get those fluids to free up.
What fluids?
So it was originally conceived as really, oh, this is fluctuation of cerebral spinal fluid, and really it's why it was called cranial, and it's what's moving from the brain through the spinal cord to the sacrum. But as it's developed over the last 60 years, we find that those same fluctuations you can feel through the interstitial fluids, through the cellular matrix. And so it's a technique that we use on the whole body.
So can you think back to the first time you were learning to give a treatment? So it sounds as though when you're giving a treatment, you can experience it or you feel the movement. How long did it take you to get trained in being able to recognize the shifts? Do you remember that?
Yeah, you know, so I took my first osteopathic cranial course 10 years ago, and I am still a beginner. In osteopathic treatment, you know, I learn more every day, and I bet I was not reliably feeling things under my hands for the first couple years, and that's a few, you know, a few courses in for sure, like, you know, 20, 30-hour courses, and then we are blessed as physicians and in general and osteopaths to be apprenticeship trained. So I spent months in offices with other DOs, you know, with my hands on theirs or our hands on the same patients and them telling me what I was feeling so that I could recognize it. But I don't think I felt confident to say, I know how to do this kind of therapy for, you know, a couple of years as a student.
And you had training in massage and training as a midwife, so you already had what I would consider to be a fair amount of training being with people in a very intimate way, because this sounds very intimate, that you're connecting to their bodies. Although it's not sexual, it's just you're experiencing them.
Right, yeah, I mean, it's subtle. It takes a very fine-tuned sense of palpation, and it takes a pretty meditative mind. People who aren't patient don't gravitate towards cranial work, and that's okay. Not everybody needs to, and other people do great kinds of other work. But this kind of work tends to attract people who are meditative, introspective, can be very still, and sense subtle changes in the body.
So does your state, can you identify if you're having a bad day, does it translate into the effectiveness of your treatments? Do you notice that?
Well, the health is very forgiving. That's what we like to say. So if I'm having a bad day, I recognize, okay, I'm having a little tough time today, but I can still settle and get into that place where I can be in communication and recognize those subtle changes.
So your treatments are somewhat separate from you so your treatments aren't necessarily dependent on whether you're having a good or bad day, because is this a matter of practice, that you're practiced at getting to a particular place, giving the treatment?
It's from experience, and because once I sit down at the table to treat someone, my hands and my brain start to go to that place automatically, no matter what was going on before that. And I think to be in a healing place with someone, you actively have to work on your own health. And I get enough rest, and I do yoga, and I meditate, and I walk every day. And you know, those are the tools that I use to keep me in the space to be able to do this kind of treatment.
Can you talk about some of the improvements you've noticed with people who are getting osteopathy treatment?
So it settles your nervous system. So lots of people will say, I just feel calmer or less anxious, or I'm sleeping better. When people ask me, what am I supposed to feel? I say, well, you should feel better. You know, it's not hocus pocus. You came in for shoulder pain. I'm hoping that you walk out with your shoulder pain improved. You know, if you don't feel better, then whatever I tell you about my treatment is irrelevant. Like, it should work. That's the bottom line. But what I also tell people is you should have like this deep sense of well-being when you leave my office. And sometimes that's like here or here, but like this deep sense in your body that everything is now connected and everything is right and well. And then hopefully that lasts.
Can you accomplish that in one treatment with people?
Well, it depends on the person.
Okay.
You know, it
That's
depends
like a tall
on
order.
what's, yeah, I mean, it depends on what's going on with them. You know, babies and kids treat really fast because they don't have all the layers of years of, you know, gunk and poor living and stress and accidents, you know, layered on top of them like adults do. I find that people who actively have their own kind of health-oriented practice, no matter what that is, whether it's healthy eating or good exercise or meditation, treat faster because they're sort of already in that space. They're already on their healing path. You know, the sicker someone is, the longer a problem has been with them, the harder it is to treat out.
That makes sense. That's fair. Tell me, do you notice if people, you just mentioned that if people are on their own path, so in one person, if they engage in some kind of healing behavior, meditation or yoga, and then they stop, do you see the difference in the way their treatments go? Or if they're not and then they start?
Yeah, I can tell. I can often tell. And sometimes it's just as simple as, oh, your shoulders are tighter today, you know, what happened in the last few weeks. And sometimes it's like, oh, your whole system is a little locked up and not responding the way I expect it to. And sometimes that is a physical issue, and sometimes it's an emotional issue. Sometimes an emotional trauma will also do that.
How long do your treatments typically last?
20 to 25 minutes. Yeah, they're booked as 30 minutes. It gives me a chance to get some history and get settled in, but probably about 25 minutes.
And do people come back for repeat treatments, or what happens? They come once and then you figure out how often they need to come?
Yeah, and I do like to see them before I make that decision, because one person might actually be in very acute pain and need to come once a week for a few weeks, and the next person, you know, once a month. I would say on average, I like to do 3 or 4 treatments 2 to 3 weeks apart to start, just to get a sense of what's going on with that person's body. And it gives us a chance to see how well it's going to work for them. And I usually tell people, after 4 treatments, if you've really had no results at all, I'm going to work with you to find what kind of treatment is going to work better. Because I don't want to waste your time. I want you to find what's going to work for your body. And maybe it's acupuncture, and maybe it's massage, and maybe it's something else. But, you know, osteopathic treatment has, you know, great potential to work for all kinds of things, but it doesn't work for every single person.
Are there any ailments that would be inappropriate for osteopathy? Because what you've said so far is it sounds like it's appropriate for lots of things. Anything excluded?
I'm careful in very acute injuries, because even though what I'm doing is very gentle, it can have some deep effects. And I absolutely wouldn't want anyone to walk away you know, feeling worse in a few days and worrying that it was the treatment. So we'll often wait till a very acute injury, you know, like a severe concussion or car accident or bone break or something, you know, heals before I would institute treatment. But, you know, things like very ill people in the ICU or with cancer, you know, this is really going to do no harm.
Anyone, so far you've mentioned babies, you've mentioned people in the ICU. Is this part of what had you become a family physician, that you can treat birth to death with osteopathy? Well, hopefully you won't treat to death with osteopathy, but
well,
you can treat.
You know, I did a course once where we spent a whole day on helping ease people into the transition of death, and that's okay too. And there's a lot of benefit there, because it calms the nervous system. It helps with pain. It helps with that sensation of shortness of breath. So birth to death is just a very appropriate description. And that's what I love about family medicine. I went into medical school thinking, okay, I want to treat moms and babies. Well, I can't be a pediatrician. I can't be an OB. What can I do that I can do both? And family medicine was it. So I love the whole scope of family medicine because of that.
So let me just drill down into this. You're accepting osteopathy patients.
Yep.
And if someone wants to bring their baby to you, you'll do the primary care for the baby?
Yes, yeah. But my practice is really full right now, and it's hard to just take all new patients, but I'm always open to new infants and their families. And by virtue of family medicine, you can't separate families,
right.
So always families.
So how soon after birth do you see a baby, and do you do an osteopathy treatment on a baby?
I do, as soon as possible. You know, even a really normal natural birth has compressive forces in it. And birth is a beautiful process. I don't see it as a traumatic event. But it's great to just, you know, babies have been curled up in that little warm environment, you know, sheltered from everything for so long. And then they come out into the world and they're like, wow, what just happened? So the treatment just kind of helps everything settle and reorient. So usually when I see well babies in the first few months, I treat them every time I see them because they're so healthy, they treat in 3 minutes. Why not? Why not treat them at a well child check? So yeah, a few days old.
So you help with the cranial compression that occurs coming through the birth canal, anything in their shoulders, really anything?
Yeah, and sometimes just that, you know, your uterus gets so full, they're kind of crammed in there, and like their little hips might be just a little off or something. And the sooner you fix that stuff, you know, the more it's really preventative medicine. You're really preventing other issues down the line.
Do you recommend people do osteopathy treatments preventively, or do you recommend people wait until there's a problem, or is there a happy medium, or both?
It's tricky because insurance likes to cover problems. Mm-hmm. So preventative care is great, but you know, for the most part, we're healthy and kids are healthy. You don't really need I don't want to medicalize what's a normal process. Mm-hmm. So I don't feel like everyone needs an osteopathic treatment. So mostly I'm treating for some kind of specific complaint. At well child checks, I do it just because I can and they're there. They don't necessarily need it, but I like to check. Specific things for infants that I love to treat are reflux, ear infections, poor feeding, colic, poor sleep, because many of those, one treatment is enough to just reorient the structure and the nervous system.
You just said something very quietly and calmly that if I were a mother with a baby with colic, I would want to have heard.
Colic is a tough one, but ear infections and reflux I've had great instant results with.
Like spitty babies?
Yeah. So colic, you know, there's so many different layers to colic, and we don't really know what causes it.
So we'll throw that one out.
No, I wouldn't throw it out. I'm happy to treat colic. I just, you know, I can't promise in one treatment it'll be gone. And actually, especially, well, in all of those situations, that's where the functional medicine comes in. Mm-hmm. You know, the next thing is, okay, what's the mom eating? You know, what else is going on with this child that could be irritating their system and making them not as healthy as they should be?
So you mentioned something, is osteopathy typically covered by insurance?
Most insurances cover. Yep, I mean, every plan is different. Everyone has to check their plan, but most insurances in Massachusetts cover. Yeah, you might have like a number of visits per year, that's a limit, or share that coverage with chiropractic. So if you've used it up on chiropractic visits, you can't use it on osteopathic. But yeah, it's well covered.
Does osteopathy make a difference for women and women's issues?
So women have lots of the same issues as men. So when I think of women's issues, I'm thinking like menstrual problems or infertility or endometriosis, like more specifically OBGYN type pelvic complaints. Yes, whenever again, it comes back to the structure and function issue. So if the structure of the pelvis is off, it's mm-hmm. going to affect the circulation to the pelvis. Mm-hmm. And, you know, I hear some OBs talking about like pelvic congestion syndrome. Mm-hmm. So that's where osteopathic treatment is a natural segue. Like, how can we maximize the orientation of the bony pelvis, but also the muscles around the pelvis and the fascial layers and tissues to maximize the arterial flow in and then maximize the venous flow and lymphatic flow out, so that the organs are getting the oxygen they need and the nutrients they need, but it's not, the waste products are not getting stuck there.
Mm-hmm. So it sounds like for women who have painful menses, infertility, endometriosis, pelvic pain, something might make a difference in treating that.
Yeah.
Okay.
Yeah, again, you know, not necessarily a quick fix, but definitely worth a try as part of a complete treatment plan.
So when teenagers show up and they are experiencing a difficult transition from not menstruating into menstruating, is that a good time to send them into osteopathy to see if their pelvic organs can align, essentially?
Yeah, absolutely. And it's always a whole body treatment, because we're also looking at the pituitary gland and what it's doing, and, you know, thyroid, and, you know, you can't just treat the pelvis for a pelvic complaint. So it still would be a full body treatment.
This is so interesting to me. Like, and when you're describing your treatments, do you have an elevator speech that you use, like osteopathy is? Do you have that?
My goal is to access the health of your system and help it express itself to its fullest extent. And I do that through working on your structure. Again, doors to the same room. Functional medicine also gets you there to a point. Mindfulness, acupuncture, so many different things get you there. And the kind of osteopathic treatment I do is one way to do it. I have a handout that I give them that is from a book by Andrew Weil, Spontaneous Healing, where he writes about a very famous osteopath, Robert Fulford. And it's great because he is an MD, so he's writing from a little bit of an outsider perspective, and it describes what a treatment feels like and what to expect. So that's like, here, let me spend the time we have today, because it's short, doing a treatment. You see how you feel and read this article and come back with questions next time.
Okay. As we come to the end of the show, is there anything that I didn't ask you that might be valuable?
I think we really covered everything.
We covered a lot.
I mean, and I, you know, as you know, I do functional medicine, and functional medicine is also about supporting the health of the system, finding out root cause, figuring out how we can help that person heal from the inside out, not just mask symptoms. So to me, the osteopathic medicine and the functional medicine are a perfect blend in practice.
Yeah, I think they go nicely. Yes. All right. Thank you so much for joining us for another episode of Visions for Health. My guest today was Dr. Noelle Lee, board-certified family medicine and osteopath. Thank you so much.